Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Clobazam. Its brand name is Onfi. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So Clobazam is indicated to be used as an adjunct or add-on therapy to treat seizures associated with lennox-gastaut syndrome in patients 2 years or older. Now, before somebody was to use Clobazam, there is a contraindication that they must clear, which in this case would just be a hypersensitivity to Clobazam or to any other component of the formulation. And there's also some precautions and warnings that they should be made aware of. Patients should be made aware that physical and psychological dependence may occur with the use of Clobazam, and patients, especially with a history of drug abuse, should be monitored. Dermatological skin reactions such as Stevens-Johnson syndrome or toxic epidermal necrolysis have been reported, so patients should be informed to stop the medication at the first sign of a rash and visit their physician. Dose-related somnolence or sedation may occur with the use of Clobazam, particularly in the first month of therapy, and patients may be at an increased risk of experiencing these if they are using other CNS depressants, such as alcohol. Abrupt discontinuation of Clobazam may result in seizures or withdrawal symptoms. These would include convulsions, hallucinations, psychosis, behavioral problems, tremors, or anxiety. This would be more likely with higher doses and prolonged use. And lastly, for precautions, patients should be made aware that suicidal behavior or ideation may occur with the use of Clobazam. Now, once somebody has cleared that contraindication and is made aware of the precautions and warnings, and they start to use Clobazam, they may receive their dose orally through a film, suspension, or tablet. So if a patient is using this medication to treat seizures and they're less than 30 kilograms in weight, they would typically start off with 5 milligrams once daily, and then on day 7 they could switch the dose to 10 milligrams given in 2 divided doses. And then on day 14, they could give 20 milligrams per day, again given in 2 divided doses. If the patient weighed greater than 30 kilograms, they could start off with 10 milligrams daily, given in 2 divided doses, and then on day 7, switch to 20 milligrams daily, again in 2 divided doses, and on day 14, could use 40 milligrams daily in 2 divided doses. If a patient was coming off the medication, they should come off the medication gradually by decreasing the dose by 5 or 10 milligrams each week until off the medication. As with all medications, there are some side effects or adverse reactions that patients may experience while using Clobazam, so I'll go over some of those here now. 2 to 10% may experience constipation, and up to 14% may experience drooling. 2 to 10% may experience ataxia, and 2 to 7% may experience insomnia. Lethargy may happen between 5 and 15% of the time, and sedation may happen 2 to 9% of the time. 16 to 25% of patients may experience somnolence. Aggressive behavior may happen in 3 to 14% of patients, and 2 to 5% may develop a urinary tract disease. 3 to 7% may develop a cough, and 10 to 17% may develop a fever. Some more rare but serious side effects would be the dermatological side effects we mentioned, such as Stevens-Johnson syndrome or toxic epidermal necrolysis, as well as a hypersensitivity reaction. That's all we're going to talk about today with Clobazam or Onfi. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found this information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.